We talked before about how I don't think CEOs should be in politics.
Hmm.
This is why. Um,
Right. Well, is healthcare an industry that is best suited for a capitalist structure?
right. It's just not. It's not looking at the benefit of the people. When I think people, if people are the thing that you're trying to help, kind of probably either should be regulated more effectively, and or probably not in the free market.
So I don't know. The big story, I guess, this week is the one that just happened yesterday, which is this United Healthcare CEO getting capped on New York streets, mean streets in New York City.
But he was in Midtown,
Yeah, no,
probably one of the safest places to be in New York City.
unless
And
you're the CEO of of the largest health insurance organization in North America.
that's kind of how that's playing out now. So put that on the brochure. Um, I'm kind of the loss of human life sucks.
Yes.
Whatever motivated this person to do it, who's still, as of the 5th, is still on the run. I mean, we'll never know, but I, this sounds really bad. If it was that planned and that determined, something bad must have happened. And our healthcare system is not innocent in this crime. So,
No. Um, and you're right that I just want to echo that, like, yes, the loss of life, did this specific individual deserve this?
right.
You know, most likely not. But
If he could have shot the company, he would have shot the company.
yeah, exactly. Right. This was more of a stand-in
Right.
for that. And I don't know. We've talked about it on the podcast before that that we're getting into kind of a dark, or at least on the precipice of a dark period here, and you see the response on Reddit and a lot of the other social media channels and stuff like that to this. Somebody did a graph and it was over like 70% where the laugh emoji reacts.
I'm not an anti-capitalist, which, like, when I see things on YouTube from the left, they're very staunchly anti-capitalist.
Mm-hmm.
I understand. Um, Nor do I have a replacement for capitalism. I just think that we're implementing it the wrong way. To be fair, um, it I think the oligarchy that we've created, but we don't acknowledge in our country, is detrimental to the future growth of the country.
Yeah.
This, one could say, is the byproduct of that. Um, I'm not saying companies should be broken up because everything's a monopoly. I don't go that far, but I do think there's room for smart regulation that helps the society, and we haven't figured that part out yet. Whether it's the healthcare system, um, whether it's agriculture, there's a lot of industries where I could say, yeah, that's probably not the best outcome. Um, but to healthcare in general, what frustrates me is that we talk about how we're the world's richest country with the most expensive healthcare and the most expensive healthcare coverage,
Mm-hmm.
but we have the least, or we're not in the top 5 or 10 in the healthy outcome for the society. So something's broken there, obviously.
Yeah.
We should be asking different questions, and our government, if they're doing their job, should be seeking a different result, and that's a failure on leadership. So
Yeah. Yeah, wholeheartedly. I think it's interesting, like the response from
you're not going to find sympathy from people.
Well, no, not even that, but just the response that they had from a police presence and all of that after it happened, and the manhunt and all of this, and they're we've deployed drones and canines and all of these, and
Good luck.
again the response is like, you kill one person, it's murder, but you kill thousands of people by denying them coverage over the years, and that's
okay.
You're an entrepreneur.
Yeah, I saw that on Reddit. Full disclosure, I poke around at Reddit for dev stuff, but every now and then I look at what's popular, and that those comments are prevalent. I don't even think those people are being so cynical towards the loss of life.
Right.
I think it's just stating the obvious.
It's right, underscoring. I mean, there. It's not. We don't treat it all the same, right? We don't treat all life the same.
Right.
We don't treat all crimes the same. We don't. Somebody gets murdered, it's not the same response that we saw today, right? But and it's hard not to be cynical in looking at, well, yeah, this is the system playing out the way it's supposed to. It's Midtown Manhattan, right? You've got how many CEOs that regularly visit that area every day, and you want them to think that their lives are on the line when they're probably contributing significantly towards whatever.
Well, just so let's take a step back.
Yep.
This person knew where this guy would be. He must have. When they say it was planned, it had to have been planned.
Yep.
He knew his travel path to and from the hotel. So it means while he lives outside of Minnesota, so he must have been frequenting this a normal restaurant or wherever enough times twice in a couple days.
Mm-hmm.
Around the same time. He knew whenever the convention was going to start or the conference was going to start or their annual meeting was going to start. So the probability of him finding him is probably well over 50%. And even the calmness of he didn't have a security detail, even though he had threats.
Mm-hmm.
So he knew he was exposed. If the reaction is CEOs that get death threats start getting security details, well, okay, then you missed the point. You missed the plot.
Right.
So it makes me still think whatever happened was bad enough to anger this person.
Right.
That was the outcome he wanted.
This wasn't just some random,
Right. Something happened.
Yeah. This wasn't a guy who got a large bill for his appendicitis or,
This is somebody probably died because of a decision an insurance company made. So there's that. And I want to reiterate, I'm not dismissing the loss of life.
Yeah.
But if we're focused more on the CEO of a company getting murdered as opposed to what caused that, then we're missing the plot. Like I don't know what to say.
Back to root causes and symptoms, right?
Right.
The security detail, that's a Band-Aid on a symptom.
Right.
You're not understanding what's driving that. And I think unfortunately that there is a lot of that, the lack of sympathy and to some degree like the cheering of it by some people, that like, yeah, whatever, take them down. There are so many people who feel completely disillusioned with the justice system and the way that our society operates in this country. The fact that those things just go on, and this guy, I cashed some ridiculous amount of bonus money over the last, several years. And yeah, I get you're the CEO of a major,
sure.
health insurance organization, right? But it's hard when you as the individual are experiencing the results of the decisions that are being made in terms of coverage being denied, or a loved one of yours is experiencing that. And like you said, this is almost undoubtedly a situation where somebody lost somebody and was driven to do this, and we need to try and understand why, so that we can fix the root cause, which is most likely a super broken healthcare system in this country.
Right. Or not even super broke. We talked before about how I don't think CEOs should be in politics.
Mm-hmm.
This is why.
Right. Well, is healthcare an industry that is best suited for a capitalist structure?
Right. It's just not. It's not looking at the benefit of the people. When I think if people are the thing that you're trying to help, kind of probably either should be regulated more effectively, and or probably not in the free market.
Yeah.
What I didn't realize how broken healthcare was until so when my wife and I got together, and like we had separate insurance because she worked for the state, and um it was pretty much like free for the most part. So it's like not a very big expense. I worked for McDonald's, but I had all the kids on my plan, and it cost me like I think $70 a month. Right? If she would have had the kids on her plan, it would have been like $500 a month or something like that.
Jeez.
And Blue Cross Blue Shield at the time, one in North Carolina, the other in Illinois. And I'm like, how does this happen? And I started looking into it. And most states, and North Carolina being one of them, they have an insurance commission
Mm-hmm.
that they don't really help the people of the state. They kind of make sure they get their cut from the companies. They don't care about rates for the most part. They don't care about uh, the cost of coverage per person or per family. So even after the Affordable Care Act passed, I had a former customer that worked for an insurance company, and he explained to me how the pooling of premiums was going to affect my personal rate, right?
Mm-hmm.
And it did. It's net. Granted, I wasn't pleased with it at the onset because I think it was like an extra $300 a year or something like that. Um, but for the benefit of other people, kind of made sense, right?
Because if if that's not the idea behind insurance, right? Pooling risk,
Right.
then what is? Right? Then why do we buy insurance in the first place? Why wouldn't you just save money and pay out of pocket, or take out a loan whenever you got sick and pay that off that way, right? Like there's a whole reason that it's supposed to be done this way, and it's to mitigate risk and minimize cost by spreading it out, not minimize costs, but you know what I mean? It's just like
What's ironic to the UHC problem is apparently they've been using. Remember when I said black box software is going to be the problem? I'm concerned with AI.
mm-hmm.
Well, apparently they've been using AI to deny claims.
Shocking.
What are we doing? Like that's the stuff that should concern us about AI.
Maybe that's why my prescription hasn't gone through yet.
So we can't nor should we let these things be. Some things should still have human intervention. And again, I'm not, cheering for the loss of life for this person, but I think that we're probably never going to address the why as to why it happened.
Yeah.
Nor do I think that nor do I think it'll get solved. I don't think our government functions in a way to solve the problem, nor will it ever. Because we
doesn't
have
seem like it's
everything.
really designed to right now,
Nor will it be in 2025. So there's that. Yeah.
We can always hope that Project 2025 fixes everything, right?
There's hope.
I thought Hope was a girl that works in drive-thru.
She is. She gets off at 4.
She does. She's already gone for the day.
There's nobody.
There's nobody in drive-thru anymore. Fuck. No wonder I hear all those horns. Thanks for checking out the Chris and Andre show. Remember, unlike yourself in middle school, those like and subscribe buttons aren't going to hit themselves. And be sure to leave a comment with your favorite part of the show or a topic you'd like us to cover in the future. As always, stay salty.